NEET exam, that is 2017-18 topper, Dr. Nachiket Kaneria. He has scored 753 marks. Hello, doctor.
Hello.
It's a pleasure to have him with us, and I would request him to explain how did you go about your preparation.
So my goal was to get a seat in my first attempt itself, and this goal I had decided ever since I started my first year.
Okay.
I had begun preparation from then only, and I tried to do all the minor subjects and as well as the clinical subjects at least by the time I finished my undergraduation.
Okay.
So I was done with around 11 subjects by the time final year got over, and after that I started preparing the basic subjects, and basically it was just consistent work and
Okay. So you joined us for a 1-year program.
Yeah,
so,
I joined DIAMS for the final year subjects, and I did all the clinical subjects as well as the minor subjects, which include psychiatry, ortho.
Okay. So how did these sessions? How these sessions were useful in a sense that they provided some new information, updates?
Yeah. Most of all, these sessions were very motivating or encouraging.
Okay.
And it was really nice to study under all these professors from prominent colleges, and especially I remember my first lecture was, I think, psychiatry under Dr. Dharmender.
Okay.
And he was very motivating and all that, and from then itself I started working, and Dr. Marwa and Dr. Purva Mehra and everybody.
Okay. So is it that you the advantage of joining a coaching, is it that you are able to revise in a shorter time frame? I mean, if I say self-study versus joining a coaching, what is more advantages?
Well, both is actually both.
Yeah, it's a combination.
Yeah.
It's a combination.
So the advantage of classes is that you get notes, and many of the things are you get from these notes, and plus you get a base from which you can start preparing, a gist of the topic. And this is really important towards the end of the preparation time, when you want to revise these subjects. You cannot revise from the books itself. You need some form of notes, and these accurate notes which you get from classes are really very helpful.
So you found DIAMS notes useful for
especially medicine, orthopedics, minor, basically all the subjects.
So doctor, how, let me say, my subject, if I talk about medicine, how useful was it? I mean, in a sense that you have Harrison on one hand, it's not obviously possible to read it. So what was the advantage actually for the notes?
The notes, it is advantageous that you can read the notes once, and then you can start solving the MCQs from the MCQ book itself. And I had used your book, medicine book, for this purpose, and so I read your notes.
Okay, so you attended my class, did the notes thoroughly, and then you went for MCQs.
Yeah.
Okay.
And that helps in solving the MCQs quickly, and also if there is some new information in the book, then you can add in the...
Okay, so Nachiket, here I would like to just interject by saying, some people, they say that we should study retrospectively, that they read an MCQ first, then they go back to theory. So what would you suggest? Reading MCQ, going back to theory, or first attending a class, reading notes properly, and then reading the book and doing MCQs? I mean, which approach is much productive?
I don't think retrospective approach is that helpful. I think you need to be at least somewhat confident or somewhat proficient in the subject, because if you do retrospectively, then you are going to get confused. At least it's going to take a very long time to solve the MCQs. So basically for these exams like NEET, you need to solve as many MCQs as possible, and that you need speed for that.
Okay, so that's again an interesting point that Nachiket came up. Speed is very, very important.
Yeah, you need to be accurate as well as you need to be fast. And for that, if you read your notes or if you read the topic before solving the MCQs, then that becomes really, really helpful.
So concept-based learning is more important than simple cramming and verbal.
And also the thing about doing MCQs after reading is it's you can take it as a form of a test, right? And so basically for NEET, for any exam, you are not what is helping you is not what you learn but what you recall. Yes. So you need to practice recalling more than learning. And, so MCQs are that way. If you approach MCQs in that way,
so Nachiket, what were your fear factor? I mean, which subjects were like a nightmare for you?
Anatomy, biochemistry.
Okay.
And,
so how did you handle it? I mean, suppose that X subject is a nightmare for you. So how did you prepare it? I mean, did you like dedicate 10 days to it, or is it like you used to study part wise?
No, so I studied it like any other subject.
Okay.
I just read it properly and then solved the MCQs properly. So these volatile subjects basically like anatomy, biochemistry, microbiology. Again, grant tests are really important, and so whenever you do these grant tests, before giving the grant test, you have to at least revise these subjects, these volatile subjects, or whatever subject which you find difficult, and that will stay with you for a long time. This was actually a mistake which I made. I didn't do this. So I realized this too late. So
So how many revisions, Nachiket, did you do?
Well, I must say 5.
5. Oh, great. So what was your cutoff point? I mean, by what time did you finish your?
I took 4 months to do it once.
Okay.
Then 2 months to do it the other time.
Okay, and just drawing a timeline. Like, suppose you joined in February batch. February. Which month did you join?
Actually, no. I joined DIAMS during my final year.
Okay.
And during internship, I was more involved with self study because I had to go
for duty.
Yeah.
Okay. So first 4 months for first revision.
Yeah, first 4 months for first revision, and then 2 months for the second one, and then around 1.5 months for the third one. And after that, I really picked up the speed. Like in 1 or 2 days, I was able to do subjects. Like for long subjects, 3 days.
Okay. So Nachiket, did image-based session ever help you?
Yes. So image-based session, it did help, but.
Okay, so questions, image-based questions are usually like, they?
So image-based,
what was your approach for solving image-based questions?
I just used in any MCQ book, in every MCQ book, images. So I just
practice from there.
Yeah, and also I looked online. For example, there is an app called Medscape, and so whenever I reading a topic.
So you used to look at Medscape basically.
Yeah, or you can just Google.
Okay, yes. Okay, Nachiket, last question to you. Last 1 week before the exam, like how were you feeling? I mean, were you under the nerves? Were you like total aggressive?
No, actually, so I was under the nerves 1 month before the exam.
Okay.
Because
this happens to everybody, so that's why I'm asking to everybody. Like, what do you do? Because people tend to panic in the end, and that negatively affects your result. So I thought that I'll put this question to everybody because I usually get queries from students that what we should
even
do.
I had that.
Okay. So now you are in a position to actually explain to the younger chaps what to do.
So 1 month, I actually had the nerves 1 month before the exam because during that time, up till that time, I was doing really well in the grant test and all that. But then this one grant test, I got less marks, and so I felt very I felt like I was failing, or I don't know, I wasn't doing well enough. I was getting complacent. So for the last 1 month or like 25 days, I prepared a timetable to finish the entire syllabus once, and to have the last week for revision.
Okay.
So before, I did the entire course, and then I had like 6 or 7 days for revision. And while I was doing the last 1 month preparation, I was using those
stick-on pads. Yeah.
Stick-on, not the pads, but like those thin, like fluorescent page markers. So basically, I was marking all the topics which I wanted to read for the last 7 days. So I dread lists. I
Okay.
really don't like lists
Okay.
because I tend to forget lists and it gets very boring. So sometimes I take like 15 minutes to do one list because I'm daydreaming by the time I get through
Okay.
3 or 4.
Okay.
So I marked all the lists, I marked all these volatile things which I wanted to read.
Okay. Okay. So last question to you, Nachiket.
Yeah.
To score 753, how many hours per day were you studying? Let me say for
On an average, 6 to 8 hours.
6 to 8 hours a day.
Yeah.
So is it like an average 6 to 8? Like some days more, some days
Some
less?
days more, some days less. Yeah.
Okay.
But yeah, that happened a lot with me. But if you do consistent work, then you can definitely get better. I could have done better,
Okay.
but yeah, I don't have any regrets as such because
Okay. Okay. No, because I've had candidates who say 10 to 12 hours, 14
no,
hours.
that's no 6 to 8 hours is enough. I think 6 to
Okay.
8 hours. With 6 to 8 hours, you can. So yeah, I did.
So it's like 6 hours constant. You were just sitting in front of a book and focusing on all the facts. That's it.
No, not like that.
Okay.
But 6 to 8 hours is an average time.
Okay.
Right? Like, for example, if I have emergencies on Wednesday and Saturday, then on Wednesday and Saturday I can only study for an hour. Like before going to the emergency, I
Absolutely.
read for an hour, and then whenever I get time, I had fixed